Hey everyone, I'm Dr. Mache Seibel, and today I want to talk to you about the subject of a new study that came out in the New England Journal of Medicine on March 14, 2013. And this is a study that looked at some 2,186 women who had breast cancer. Most of them were in menopause, and they received radiation therapy as part of their treatment for the breast cancer. And what they found out is that they gave the radiotherapy for whatever the usual duration of time was, and the duration of which the window these women were treated was from 1958 to 2001. So the patients were studied a few years ago. And then they looked at the incidence of heart disease. And what they found out is that the women with breast cancer who got radiation therapy at the dosages at that time started to have an increased risk of heart attack, starting at 5 years after the treatment ended and extending all the way out for 20 years after treatment ended. Seemed to end after about 20 years. So what this means is that the women who had the highest dosages ended up with the highest risk of heart disease, and the women who had a pre-existing heart problem were also more at risk. So this is really a double whammy for women, because first of all, you've got the issue that the radiation treatment, which is an important part of treatment for not all, but for many women who have breast cancer, can be harmful to the heart at the dosages at that time. And I say the dosages at that time because good news is that today the dosages are a little bit lower. But the second thing is that estrogen, which can be protective of heart disease if it started in the window right after menopause, can't be given to most women who have had breast cancer. So they can't take estrogen, which is helpful, and they have the increased risk of radiation. So here's what this means to you. If you are a woman with breast cancer and need radiation, talk to your doctors about this. Understand the risk and the benefits, understand the dosages, consider all of your treatment options, and realize that you need to individualize the care that you get so that you're getting the best benefit and the lowest risk. So I want to just mention to you that if you're interested in these kinds of articles and information, you can go to My Menopause magazine in the Apple newsstand and get other related kinds of information that will be helpful to you in your transition into and beyond menopause.